Hey, my name is Kyle Eudailey. I'm one of the cardiac surgeons here at University of Alabama, Birmingham. Giving a brief talk today regarding thoracic aortic aneurysms, answering a few questions that I typically get in clinic from my aneurysm patients, because there's a lot of confusion around aneurysms often, and a lot of misinformation around aneurysms. So just to sort of better define everything, we're talking about thoracic aortic aneurysms, and really these are any aortic aneurysms that are in the thoracic cavity, and that's from the neck down to about the belly button. I'm a surgeon, and so surgeons, we love anatomy, and so it's really important for us to sort of define anatomy, because this helps us explain where the aneurysms are and also how we treat them. So heart is here like this. The aorta is the largest blood vessel of the body, and it comes out of the heart, it goes up here to the head vessels, makes a turn here in the chest, kind of comes down this way. Here's your diaphragm, comes down here, ultimately splits off to your leg vessels. This is the blood flow to your intestines and kidneys down here, okay? The aortic valve, which is the last valve to leave your heart, sits right here. The thoracic aneurysms are really anywhere between here and here in terms of aortic aneurysms. What's important, though, even within thoracic aneurysms, is that there's a significant amount of difference in terms of anatomy, and it's important to define this anatomy. Down by the aortic valve, we consider this the root. This here, we consider the ascending. Here, where the head vessels are, we consider this the aortic arch, and then down in the chest, this is the descending thoracic aorta. The reason that's important is there's subtle differences in terms of how we treat all these parts of the aorta. I guess we really should define exactly what an aneurysm means in terms of an aortic aneurysm. An aneurysm is simply any dilation of a blood vessel. The aorta happens to be the largest blood vessel in your body, and so dilation of this vessel is significant. The aorta is built like a 3-ply garden hose, and it has 3 layers, like so. When we have an aneurysm, there's a stretching of these layers, and simply there's a dilation of the vessel. The reason this is important is the tissue of the aortic wall loses some of its strength as it gets stretched. And really the best way to think about that is a balloon. So when you first blow up a balloon, it's hard to blow up, but as that balloon gets bigger and bigger, it gets easier and easier to blow up. And basically the tension on the aortic wall increases at larger diameters, and the strength of the aortic wall sort of decreases at larger diameters. That's important because usually aneurysms, they don't necessarily pop like a balloon, but what we worry about is actually a tearing or dissecting of the layers in here. So ultimately, what does all this mean? Unfortunately, there's a lot of nuance into how we treat aneurysms between individuals. Ultimately, the biggest thing we worry about is really the risk of surveillance, meaning the risk of keeping an eye on the aneurysm, versus the risk of an intervention, meaning the risk of either surgery or a stent. There's a lot that plays into the difference of how we lean towards surveillance and how we lean towards an intervention. It also has to do with a lot of the associated diseases that patients can have. But ultimately, it's a very personalized and individual discussion as to when we consider an intervention. Typically, we like patients to be followed when they start to have any dilation of their aorta greater than about 4.5 centimeters. But that is not necessarily a big concern if they're at that size. Really, the biggest thing is making sure that they're plugged into a set of providers who are focused on aortic disease and who are going to be able to give them a sort of tailored approach as to how they think about their aneurysm and when to intervene. If you're interested in learning more about being seen at UAB, please follow the details below, and we can get you seen and plugged in with an aortic specialist and get an individualized approach to you.